Hi everybody, I'm Dr. John Degenhardt. This is Sue Mikatavich. Tonight's show is going to be special. Thank you for coming to Let's Talk Chiropractic. That's when we come into your house and explain what chiropractic does. So Sue, give everybody just a 30-second introduction.
Hi, my name is Sue Mikatavich. I'm from Gordon, Pennsylvania. I have 3 adult children and 3 grandchildren, and happy to be treating with Dr. John.
I want you to go get a glass of water, a pizza or burger, have a seat, come back in a few seconds. Let's listen to her story. See if you can connect with the problem she had. So come right back. Welcome back to Let's Talk Chiropractic. Let's go right to the beginning. Sue came here about 3-4 months ago. You had a right hip pain for about 3 years, my understanding was. Go back if you can. What caused that pain and what was the pain like back then?
I didn't have any specific injury to my hip, but suffered a lot of pain in that area, in my right hip. Things like sitting for a long time, standing for a long time, uncomfortable sleeping on that side at night. There were times where when I would get up from a chair, I would have a stabbing pain. So it was constant. It was a daily thing that I dealt with.
During those 3 years, what did you do to try to alleviate that pain?
Well, I did see other chiropractors, and I went to physical therapy. I used some over-the-counter pain meds and then prescription pain meds. The treatment was short-term for me, so I kind of laid off for a while and didn't do anything, and then started to come to you.
So I'm curious. Tell people, what do you do for a living? Like, why was the right hip pain stopping you from functioning properly?
Well, I work, and I'm at a computer constantly in my days. And, I tried to find ways to step away from the computer a lot during the day, sit, stand, walk, all kinds of things like that to help me with the pain that I was having. It was just an everyday occurrence for me.
So I'm curious, so for 3 years, physical therapy, pain meds, other chiropractors just weren't quite doing it?
No.
When someone said, try this office, did you think, well, I already tried chiropractic? Like, what did you think?
And you're right, I did. I didn't think I'd go back, but my Aunt Donna, who I was talking to one day, she also had pain in her hip. She came here years ago, and she said, oh, I have the solution for you. You've got to go to this chiropractor. And she made it sound so wonderful that I couldn't say no, and I gave your office a call.
Well, after 3 years,
Yeah.
from what I remember, your right leg was a ½ off.
Yeah.
We adjusted it, you put some ice, and that was sort of easy.
Yeah, it was.
So I'm curious, what did we do different that made such an easy solution for you?
You have to tell me what you did because you're the one that healed it.
Well,
and I haven't had any pain since, and I believe that was back in April.
Great, and that's why at the end of today's show, let's do the adjustment.
Okay.
Some chiropractors, and again, I don't know who you went to and what they did, but I've seen it in this office. So we measure the length of the legs, and we'll show it on TV. But when you see how much your right side was off, we adjusted it. It was like easy to fix. So some guys, I think that they don't do that test.
Right.
It's an orthopedic test. So I do that on every patient, every visit, because what if I don't do that test? That I don't know what to fix.
Right.
So as that resolved, then you started telling me more about you had an injury as a child. Go back to that injury.
Oh boy.
I know that was 40 years ago.
It's a long time ago. I was in 4th grade.
Okay.
And my parents had a bar and restaurant, and it was our playground on the nights that the business was closed. So on one of those nights, my brother, my cousin, my sisters were in the bar playing, and I was on a skateboard going around the bar on my skateboard, and my older sister was doing gymnastics at the end of the bar area, and we collided. So I ran into her on my skateboard, and she hit me in the head doing a cartwheel, and I was knocked unconscious by her legs, hit me in the head, and I woke up against the wall, not in good shape.
And the point of this story is people don't realize when they watch this show, injuries 40 years ago can slowly degenerate your neck because eventually, what happened? You had to get fusion at C5, C6. How long ago was that surgery?
Yeah, it was actually a C5, C6, C7.
Okay.
And I did that less than a year ago.
And then you also started getting headaches,
Yeah.
migraines. How long ago?
Well, the headaches started right after the injury in 4th grade. I've had headaches all my life, but then eventually they turned into migraines, which I still suffer from today.
So the first point I want people to see is why we fixed your right hip when everybody else couldn't. Second point for tonight's show is this injury. So people watching the show, so their faces hit car, windshields, 30, 40, because here I hear it all day long. Yeah, doc, I fell through a rotten floor, but that was 50 years ago. That can't affect me now.
Yeah.
So in your case, you were knocked unconscious as a little girl. The neck got, in my opinion, more degenerated so that it needed a fusion. Eventually, they had terrible migraines. So many chiropractors, you know what? They would never touch your neck. They would say, because many medical doctors, neurologists would say, let's do a CAT scan. Her brain is fine. We don't know what's causing these headaches.
Right.
It's your upper neck. So the lower neck, I will not touch because of the fusions. But the upper neck, and we'll show that tonight, how we can do that adjustment. Help her headaches. Don't touch the fusion area. And again, it's a gentle little twist, nothing too rough.
Yep.
Okay, let's stop for a little break. I'm probably hitting close to the 7-minute mark. So far, folks, we were able to fix her right hip problem that everybody else wasn't able to. Then we took the courage to gently adjust her upper neck from a 40-year-old problem. So go to the bathroom, come back in a minute. Welcome back, everybody. I'm Dr. John. This is Sue. We're talking about 3 years of right hip pain that other chiropractors and physical therapy and pain meds didn't help. I remember 1 or 2 visits. It was like easy, in my opinion, to fix. Then we got into a more delicate situation. A 40-year-old injury that resulted eventually in neck fusions, but resulted in terrible migraines. And I gently explained to her, I said, let's not touch the fusion area, but let's gently work on the neck area. Be honest, were you afraid at all that I was going to work on your neck at all after having surgery?
I had a mild concern, but we worked on this after you helped me with the hip, so I had a lot more confidence going into that. So I was okay to try it, absolutely.
You know, I see commercials on TV, and when they show migraine medications, it'll show like a blurry background. And chiropractic, I herniated a lumbar disc playing soccer. So I know what it's like to sleep on the floor for 9 months in terrible pain when no doctors could help my low back. I've never had a headache. So explain for the viewers who have migraines what your migraines are like.
Well, they're no fun for sure, and I kind of get 2 different kinds. I get ones with an aura and without an aura. And the ones that you get with an aura is kind of like a warning signal for me, where in my direct vision I start to get blurry, zigzaggy lines. And this lasts for about 15 to 20 minutes, where driving is out of the question. Working on the computer that I do every day is extremely difficult. I have to walk away and let it pass. And you know, what happens is this little ziggly line kind of goes across your vision, and then it kind of opens up, and it's just all these, you know, strange, you know, lines. And then eventually it just grows out of your vision. And that takes a good 15 or 20 minutes to happen. That's when I immediately have to take some prescription medication, because once that goes out of my line of vision, bam, that's when I get hit with a really bad migraine. You know, light sensitivity, you know, scent, smells are super strong for me to the point where I could end up in the bathroom vomiting. You know, and then the other type I get is a little different when I don't have the aura. Just 2 days ago I had one, and you know, I get a pain in my nose, my lips, my mouth, my throat, which again, I've had all kinds of testing done to determine why I get these strange symptoms. And you know, I believe they're all related to my upper neck.
And that's why I love what I do. So in my work, women like you go to a medical doctor, they can't find the cause of it, so they send them to a neurologist. I've seen this 100 times where the neurologist does a CAT scan of the brain. Brains are fine. Nothing wrong with
Yep.
your brain. Your husband or kids might disagree with that,
Yep.
but your brain is good in my
Yeah,
opinion.
they don't.
But so here's the chiropractic perspective.
Yeah.
40 years ago, this beautiful little girl bangs heads with her sister, becomes unconscious. Years later, from that trauma, it misaligns her lower cervical spine. The discs degenerate so bad, she has to get fusion, C5, 6, and 7. And that was, you needed it because their arms are going numb, things like that. But I think what they failed to look at, and that's why chiropractic is beautiful, the upper neck. When you hit your head against her head, if you were adjusted probably back then by a chiropractor, these migraines would have never happened. So.
Yeah.
But I think it festered and festered, and now that I have to be careful and gentle with you. So when medical doctors will say to my patients, don't let a chiropractor crack your neck. A good chiropractor has to be respectful and say, in your case, I will not crack the lower neck.
Right.
We will stay away from C5, 6, and 7. But can I gently adjust the upper neck? Taking some pressure, there's vertebral and carotid arteries. As we move that, and we're talking a millimeter, so when I move it just a fraction. So we can fix these migraines overnight, but each patients will say to me, John, I used to get migraines maybe on a calendar. I said to them, put X's. 24 X's the first month they come to me. Then we do little adjustments the next month, 17. Then maybe 11, until none at all. So it might take months of gentle chiropractic care, of not just some chiropractors, and again, I'm not putting down those guys, but they would just get your neck and they're rough. And they scare people.
Yes.
They would get your neck so and it, boom. And I go to these conferences and I say to myself, I don't want to be adjusted by those guys. Their attitude is just crack both sides and let everything sort of fall into place. Especially in your case, don't touch your lower cervical spine at all. Gently, we get like a little click, we're done.
Yep.
And I think we've only done it about, what, 3 times, I think we said?
Two only, yeah.
Did you see any reduction at all in the frequency or the severity of these auras that you were talking about?
I have, and especially with the daily headaches. You know, those are the ones that don't bother me as much because I'm used to them. I've had them most of my life. Okay. You know, but working on getting rid of the migraines would be awesome.
Well, you know where I love my work, and that's why my wife, my family see. We're here 43 years now, but when I can get rid of these migraines, like you said, you missed your appointment. So you just had a migraine how long ago?
2 days ago.
Right, so I bet you if you didn't miss that appointment, and that's why it's crucial that I see you often. So there's a dance where I have to almost say, okay, her pelvis is holding good, her pain's gone, but we have to see her often enough, because you haven't been here for what, like maybe a month?
At least a month, if not a little bit longer.
Yeah, so the goal is, and I know we just talked about it, you live about, what, a good hour from here?
About 40 minutes, yeah.
Okay, so
yeah.
thank
Worth
you
the
for
trip.
coming tonight. So the gentle art that we're going to show now in another minute. So women watching this show who have migraines, they're afraid to have the necks cracked. They're going to watch and see how we're going to make sure your right hip's in place. We'll do exactly what we did the first time I met you. We're going to adjust the neck, and so that these neurologists will now say to their patients, look for a gentle chiropractor. Because even the medical doctors are starting to realize that if the chiropractor knows his limits, if he's not real rough, the delicate art of moving that spine, no other profession does that. They'll just fill you with chronic, strong medication. You don't know the girls who say to me, my kid wanted to go to Knoebels or Hershey Park, and I said, I'm having a migraine. Go watch TV on your cell phone, close the door. And so when I can add life to your life, then I feel like, Lord, thank you. Then my life has some purpose in it.
Yes.
So, so 30 more seconds before we go for the break. When we go now to adjust you, remember you're going to lay on your back.
Yep.
There's the facets, it's called. We have to turn your head at a certain angle to move it gently. So when I go to do that, because I won your trust when your hip got better.
Absolutely.
So when girls, if they're afraid to see a chiropractor, what would you say about what they're going to see?
Don't be afraid. Don't be afraid. When my Aunt Donna recommended this to me, I never thought I'd be here for migraine treatment, and you might not think of it either. So it's absolutely worth trying Dr. John out, and he is definitely a gentle healer.
You know, when I was a kid, I used to think, how can a chiropractor who cracks backs help headaches? Because I always think headaches are in the head. So now we know with you, there's nothing wrong with the head, it's all from the neck.
Right, I didn't think of it.
Okay, well folks, honestly, it's a beautiful feeling to help people. Her right hip is better, her migraines we're going to get rid of. That's a chronic 40-year-old injury. So if you've had injuries, people are wondering, I don't know what caused my headaches. They could have had a car accident 50 years ago, and it was never corrected totally.
Right.
So let's go into the adjustment room. I want you to see what I've dedicated my life to for 43 years, 50, 60, 70 hours a week, and we get great results in this office. So come and watch. Welcome back, everybody. I'm Dr. John. This is Sue. This is the part of the show that I think is exciting. I hope everybody who watched the show so far should be saying, okay, what did he do so special to fix this right hip? They're going to watch, just to give them an idea, your right sacroiliac joint for 3 years, Sue, was like this. So physical therapy, I'm not putting them, but they do, let's strengthen the core, but the joint is still out. Let's give all this pain medication, but the joint is out. Many chiropractors, they just crack one side, crack the other side, it ends up right back where it started. So we're going to check your legs today to see if so all I did that first visit was gently tap it. I'm trying to give people a 3D understanding, so when I do this, they'll sort of know what's going on inside. Then when we do the neck adjustment, C5, 6, and 7 are fused because she had bad discs encroaching on these nerves, so we don't touch that area. She got knocked unconscious by hitting her head with your sister. Your top vertebrae, Sue, if it shifts, it puts pressure on that artery, causing these migraines. No one thinks that the alignment of the spine is crucial except us chiropractors. So we just get a little crack, little crack, little crack, until eventually you're going to say to me, maybe after 5 visits, John, they're gone. I have no more migraines at all. So, but trying to be too rough could cause injury or damage. So let's adjust your bottom, flip you over, then we'll do the neck.
Okay.
Okay? Okay, so she has a right and a left sacroiliac. I'm going to come around here. First time I met her, she did just this. She laid face down. We did this called a Kemp test. And it looks perfect, to be honest with you. So her right leg was longer. And what's nice, I haven't even seen her for, what, a month, and it's still staying in place.
Yep.
So this is how we did it. You get on her right side and her left side. So the angle of my hands is critical. I'm not pushing, I have to push it's called inferior to superior, medial to lateral, and we have this drop piece table. So as we pushed, it's just a gentle push on her ischium and her SI joint. So if you just tap it, and so when I do that to so many patients who've seen the show, they'll say, you know what, I was afraid, or I'm 80 years old with bad discs, but when I saw that table of yours, you don't have to be laid on your side and racked and cracked and twisted like some chiropractors do. It's just, and don't be misled. Don't think because it's so gentle, it's not going to help me. All the more, I think it's even more effective than you laying on your side and cracking the whole spine. So I'm not going to adjust her more than that because we don't want to adjust it too far since it is, but that's all I did the first. So think about it. For 3 years, she was in a search. Chiropractors, physical therapy, pain medication. And all they did was check her legs, tap it. We asked her to put ice, take it easy for a few days, and that was easy to fix. Now this is the more delicate part. Can we have the courage, where many chiropractors will not even do this, to adjust her upper neck to reduce her migraines and eventually heal them without irritating the fusion in the lower neck? So this is what we do. Okay, so her C7, C6, C5 don't touch the lower neck. We're going to come up above to her C1 and C2. And she can tell you, there's like a big knot on the right side of her neck. So we want you, whenever you have one of those, listen to what you said before. Medical doctors will tell migraine sufferers, it's external stuff, bright lights, scents, music, a lot of noise. Here's what I believe. Her neck is misaligned, weakening her body's ability to adapt. She cannot adapt to bright lights, to scents, to music. But as I adjust her, as her internal environment heals, she will then adapt like she's supposed to. Like I can adapt to these bright lights or to music or to scents. So we're going to gently adjust the neck and little by little take away the pressure on your brainstem, where then your nervous system works better and then your body heals the way God wanted it to. Okay? So let's go slow. So again, there's facets. We turn the neck to a certain angle. We try to let it relax a little. Now, if you can hear that on TV, it wasn't rough, but 2 good clicks. Did you hear it? So now that you saw it, we're moving those top vertebrae off the brainstem. The blood vessels, if they could talk to say, oh, finally, for 40 years, there's been pressure up here that doesn't show up on MRAs, MRIs, CAT scans, because it's a millimeter. It's just a millimeter. So now we come over to this side. Sometimes, Sue, when it moves so well from one side, I stop, especially if I haven't seen it for 4 or 5 weeks. But now the best thing for you is to go home, lay back in a recliner. Remember, on an x-ray, when she keeps her pretty chin up, the disc space is up here open. Many people watching this show, they look down, texting on their cell phones all day, and that compresses the discs. So if she could go home now and lie down on an elevated TV, watch TV, and put a little bit of an ice pack to her right side. So then we have to time this. I have to make sure maybe she comes back in about 2 weeks. We adjust it. You got to give it some time. Let it heal. Let the body. But then if I wait too long, it's going to go right back where it started from how she sleeps, and she's a very active girl with her job. So we're going to try to get another little adjustment. Then we're done. Nothing rough. It's the upper cervical spine, not C5, 6, and 7. So let's go slow. And again, if this side doesn't move, I stop, because this is the more tight damaged side. Yeah, nothing. So 2 good clunks on the left. This is her more swollen side. I didn't think it was going to move, so we stop. Here's where many chiropractors, they get nervous. Their thought is, oh my God, this patient's expecting that to crack. I have to impress this patient. I'm going to force this sucker. And they force it. Those are the horror stories. I'm not afraid to tell the patient. The left side moved good. The right side is her damaged spot. So you go home, put ice on this. Yep. It did not crack. I would say come back in about 2 weeks. Sue has become a believer of chiropractic because she gets good results. So even if you don't come to me, if you live in Philadelphia or Wilkes-Barre, wherever you get this show, go to a nice, gentle chiropractor. Let them change your life. Thank you for watching the show. Enjoy life. We only get one time to go through this life. Thank you.